Great. Welcome, everyone. So glad you are all here. And this is such an important topic. We had lots of registrants, lots of energy around this idea that we can look at multiple levels of influence in helping our colleagues manage burnout. And as leaders, we can help reduce burnout. So that's the webinar you're in right now. I'm Heather Zessiger. I'm with the American College Health Association, and we are so pleased to be offering this with our colleagues at ACE, the American Council on Education, and CUPA-HR. So thank you everyone for being here. I'll introduce our speakers in just a moment, and I wanted to ask you to use the Q&A function if you have questions. We are going to devote the first half hour to sharing some promising practices from the field for how leaders and administrators can help reduce burnout in higher ed and foster resilience. And then we will take audience questions for most of the rest of the session before wrapping up. All right, so I introduced myself. So pleased to be here on behalf of the American College Health Association and specifically our campus COVID-19 Vaccination and Mitigation Initiative. And then we'll have Margaret Sully. She will kind of set the stage for us in a couple of moments, telling us about some of her research. She's joining us from the University at Buffalo. And as our panelists, in addition to Margaret, we'll have Nikki Brower and Jeff Herring and Jane Yang. So thrilled that you all could be here. All right, and at the end, I will highlight some resources for you from our organizations. Okay, well, let me start with Margaret. Just kind of set the stage for us before we start talking about our institution level solutions. And we're at this specific moment where we are seeing the pandemic evolve. There's the Great Resignation. And why does the level of burnout seem to be so high among higher education professionals and faculty?
Fantastic, Heather. Do we have the whole day? So good afternoon and good morning for some folks. As Heather said, my name is Margaret Sully. I use she and her pronouns, and I am coming to you from surprisingly sunny Buffalo, New York. And I sort of also, just to set the stage, it is perfectly relevant to our conversation. I have my two 4-year-old twins on the other side of this door, they like to chime in sometimes, so we'll see what they have to say if it's particularly relevant. But I mention that because I think that that might resonate with some of you, for those of you working through similar conditions over the last 2 years. And, I think, to answer the question, Heather, we have to, it's not simply what we're living through right now, right? This Great Resignation, the ongoing pandemic, despite folks acting like it's done, but what the conditions have been like at colleges and universities over the past decade or two. And my research has focused a lot on ideal worker norms and the ways in which ideal worker norms drive our work as staff and faculty. And for those not familiar, right, the ideal worker was this concept that was developed by Joan Williams and Joan ACHA separately, but at the same time, which really suggests that the ideal employee is one who is able to work all the time and has a wife, and I use that language very intentionally, has a wife at home who is there to take care of any things that arise in the home. So the ideal worker can have kids, but doesn't spend any time dealing with them, right? Because there's somebody else to do that work. So I could spend a lot of time talking about the fact, right, that the ideal worker is then necessarily a man, and as a heterosexual man, is in a white heterosexual man, which then creates a lot of challenges for those of us who are none of those identities to live up to this norm. But what I really want to focus on today is the fact that it's created these conditions that we work all the time. There's this expectation that we're always responding to email, that we're available 24/7, that folks, they may be in the office from 8 to 5, but then they're working again at night. And it's this thought that you have to be immediately responsive if somebody has a question. And I think the pressures are there for folks in senior level roles, and the pressures are there for those in entry level roles. So we were already going into this with those conditions in mind. And then the COVID-19 pandemic has exacerbated all of this, right? It's created impossible working conditions for everybody. I think a little bit about those like myself who are parents, who in the first year were navigating having their kids at home while schools were virtual for many folks, and also doing their jobs full time. And I've heard stories from staff that they were expected to really be in their seats virtually from 8 to 5, right? And there were no accommodations given for the fact that they were really doing 2 full-time jobs. I also add the fact, right, that even though schools have opened back up, we still have ongoing disruptions for folks. You have classrooms shut down because of quarantine. You have cases that arise. And so people are still trying to navigate this, and they're exhausted. And then I also want to add on the fact that we're also in the midst of a second pandemic of anti-Blackness and racism. So the toll that folks of color are experiencing is even higher, right? Not to mention that COVID has disproportionately impacted Black and Brown folks. So yet, we can hear some crying on the other side of the door, yet, universities are continuing to operate as if we're in 2019. We're continuing to move forward with the planning initiatives, and really, this is not a blanket statement, but we're not always responding in the most compassionate and caring ways to our employees. So these are just a few of the reasons why we're seeing such high levels of burnout. People are exhausted, they're working all the time, and they're contending with all of these other things going outside their work lives that maybe our universities are not doing such a great job of taking into account. So I'll stop there for now.
Thank you. Thank you for painting the picture that so many of our colleagues and members are living. And one of the goals of this webinar is to bring some hope. So in response to kind of the context that Margaret has shared with us, each of our panelists will share a program or policy or kind of innovation intervention that their campus or campus they're aware of is offering. And so we wanted to take a look at what's working. How do we know? How can we advocate for it? So we will start with Nikki. Please share with us about your policy.
Hello, everyone. Nikki Brower, Illinois State University. I use she, her pronouns, and I'm in Normal, Illinois, so right in the middle of the state. Thanks, and so great to be here. I was trying to think about something that resonates with me today in this conversation. And most of my career, almost 30 years in working in higher ed, I've worked with employee wellness. And so in 2009, our institution blended student health promotion with employee wellness into health promotion and wellness, where I am the director today. And what we've been doing since then is attempting to create a campus wellness culture, policies, things like that together, looking at the campus as a community rather than audiences. And so that's the context of what I'm bringing to you today. And it's actually been a great opportunity and experience of a lifetime to be doing this work here at Illinois State and nationally with ACHA and all the colleagues. But some of the things that, one of the things that came to me today was that a yoga teacher taught me this years ago. And I know it doesn't belong to her, but she said, Nikki, we're human beings, not human doings. And so I try to remember that, and I try to share it because it's important in this work. I'll speak from a director level, and I have staff, and our lives bleed into the workday all the time. I've never really believed there was like this division between work and life, right? We're just human beings doing the best we can, right? And to keep that in perspective when we work with staff and with colleagues, that we all need support. And so we think that way in our office. So something we did a long time ago, and we still kind of do today, is we did this like inventory, very, very informal, of the health promoting policies on our campus. And so we often look for the gaps here and where could we most help the campus. And so one of the examples I'll bring you to is how we came to our breastfeeding initiative, but then a policy around those who were working in the workplace but needed places to nurse or to pump their breast milk for their babies. And so it led to a policy with HR. We helped write it. We worked with general counsel to sort of develop a plan for lactation spaces and how to open them up across the campus, and then how that communicates across campus to not only people who work here, but also our students who aren't necessarily enveloped in those policies when they're written, right? But yet they need places as well. And so we kind of create this community of, hey, if you hear of someone, send them our way. So we use our wellness ambassador network quite heavily for things like this. We've had wellness ambassadors, employee wellness ambassadors, since 1984, when our employee initiatives began. Now they've looked different throughout the years, but we use them a lot to communicate and to inform so that folks can at least get connected to the right places when it comes to supporting them. We also have a policy, it's a wellness participation policy, where our staff can request 90 minutes per week to do something to support their well-being. Sometimes it's activity, sometimes it's massage, sometimes it's wellness coaching, but they can actually request that from their supervisors, and we have a policy. It sort of sits with me, and I kind of help communicate to the campus and to supervisors. We do presentations quite a bit because I've noticed over time that folks don't realize we still have that policy. So when there's new staff, we share that policy with a packet of information as long with the breastfeeding and things like that, as well as everything else that we do. As a division of student affairs, we're now looking at like how to not overschedule our students, but how to not overschedule our staff as well. And it's been a really interesting process because that was a big shift when I came to student affairs years ago. I would sometimes say, I say to my husband, remember my happy life in HR when I would leave at 5? You know, the student rhythm is so different, right? And so it's real flexible or what have you. So we've been really kind of challenging ourselves as student affairs professionals here, and what do our students need from us and when, and we're even serving, like, how often do you want to attend events and things like that? So we're learning a great deal here. And then lastly, I'll say one thing is we've just launched a staff success survey across campus, and it's pretty robust. So it's being delivered. We're also doing one for faculty as well, but we're looking at job satisfaction, performance, department engagement, work climate, workload, professional development, employee recognition, satisfaction and enthusiasm, and then remote work, because we're really looking differently at the remote work policies and hybrid and what that can really do for our employees. And so it's well, I'm hopeful. So that's me, a little bit optimistic over here, but just a few of the things. I'll be quiet now. I'm not sure how long I spoke.
Nikki, thank you so much. A couple of questions. If you're willing to share the policy, the wellness participation policy link in the chat, that would be appreciated. Somebody else asked if you'd be willing to share the survey. I don't know if it's in a format that you could do that. And then there was a question specifically about the 90 minutes participation. Is that limited to activities on campus, or can people leave campus to go to a YMCA or a gym or something?
It is for on property, on university property. Yes. And I'll put the link in. Yes. And I don't actually have access to that staff survey, so I've just taken it.
Thanks, Nikki. We'll move over to Jane. She can speak to some of the programs in place on her campus, and then we'll wrap up this segment with Jeff, who can look at things broadly across institutions.
Hi, everyone. Nikki, I was feeling inspired as I was listening to you. And similar to Nikki, here at Emory University, where I'm employed, we have also had at an institutional level some surveys related to climate, in particular climate around diversity, equity, and inclusion. In addition to that, at an institutional level, we have had COVID-specific leave. And so at the beginning of the pandemic, there was specific childcare leave, which was separate from if someone became ill or needed to care for someone with COVID. And now that we sort of passed sort of the initial, year of COVID, as we've moved beyond that, there still remains a separate sort of COVID leave bank, which is different from sick leave, and it's different from regular vacation leave for employees. And that leave covers things like caring for someone in your family who may have COVID. If there are isolation or quarantine that needs to happen for you or someone in your family, and you need to take care of them. If there's a school shutdown and an employee needs to stay home to take care of a minor. So the leave covers all of those sorts of situations. Similar to Nikki, in my particular division in student affairs, we have also been looking at things like working from home. And so in our division of student affairs, if able, most of the units that are able are permitting employees 1 day work from home. I think the tricky thing with that is the level at which it may or may not disrupt operations. And so balancing sort of all the tensions inherent in that. We are also doing things like during low density periods. So when students were gone for the week of Thanksgiving, when students were gone for the winter recess, increasing the number of work from home days for employees, and keeping sort of a smaller group of staff on site for response. We also have some individual unit interventions related to wellness that are particular to the different units. And in some of the areas, we've also begun an extensive compensation review, because I think certainly with the pandemic, people are starting to reassess what their time is worth. And I think higher ed is sort of in this reckoning in terms of thinking about not only quality of life issues, but compensation issues as well.
Great, thank you. We've got some lots of good questions coming into the chat, which we will get to. And then Jeff, please share with us some of the things that you hold up as exemplars.
Sure, happy to. Thank you for being here. I'm Jeff Herring, University of Utah. He, him, his pronouns. I think as Margaret described this is a different, something that was taking place before the pandemic, but the pandemic was like the foot on the accelerator for some of the changes that are taking place. And so as we were going through these 2 years, first in human resources, I run human resources here at the University of Utah, and I'm the chair this year of the CUPA-HR board. But as you look at that, talk about a pandemic to put the things around your people. That's the business that we're in, is the people business, and those challenges and the flexibility and the demands and the burnout, everything that we're talking about in this has just been exacerbated. So in the profession itself, it's just the work and the value of HR went from something that was more regulatory routine into something that was really driven into wellness and health and the mental health and the working conditions and all of those things around that. So to that end, as we went through the pandemic, or as we are going through the pandemic on that, we wanted to take a look at making some changes that were going to last and be beneficial to people, to our humans, post-pandemic. Even when the pandemic is this new way of doing work, this new idea of how work is done. And so we put together a cross-sectional group on campus: finance, space planning, parking, environmental, and brought in a multifaceted coalition of group. And we designed here at the University of Utah something called Work Life Reimagined. Work Reimagined, and it really looks at what do we want work to be like, and how can we look at this. We're in the middle, as many know, of the Great Resignation, and what is it going to take for us to take a look at doing work. And there's so many benefits to doing work a different way than it was done for the last 100 years in higher education. Like I said, the environment. We're on an urban campus. The parking situation on campus, the commute, and the carbon in the air from the cars off the road. And so the space utilization, turning some of that space back into the students and the research activity, as opposed to the administrative uses that some of that have been on. So we put together that policy, and we're in a 2-year pilot with that. But we were able to take about 65% of our employees are working in some sort of hybrid or remote work environment. on any given day, that's 25 to 35% of the workforce that's off campus. Now, we have principles in place that this is still a student experience. And as the students can come on through the, that we want to make sure that the services that the students need, the faculty need, they're taken care of. My example is always, we can't, it's very job specific. You can't mow the lawn in a remote environment. That's something that doesn't work. But for the people at our solution center, our call center, that can be done even sometimes more effectively in a remote way. And I think that Margaret hit on that is really what can we do to add that flexibility to that. And so all of our programs, and I'd be happy to share the website link with our Work Reimagined on that with all of you as soon as I'm done talking here. But I think that's the way work is done has been changed significantly. Now, to the mental health and the other side of this, I think the more interesting discussion is going to be over the next few years of doing research on how do we maintain doing remote work, but still maintain, because I think the work-life balance technology has enabled us to do a lot of that work remotely, and it's provided for some of the flexibility for work-life balance. But I'm not sure that still gets the enriching, resilient personal connections that are the other part of work that are not necessarily work-driven. And so I think that's going to be our next challenge, is how do we as leaders try and help people find ways to still connect on a personal level as opposed to just a professional level, that really, I call it like building a building. The work is the bricks of the building, but it's those interpersonal connections that I think is the mortar that holds us all together. So as we look at that I think is going to be the big challenge in the future of how do we maintain connections as we're looking at managing this flexibility. So some of my thoughts.
Thank you so much. Again, good conversation in the chat. Folks are responding when there are questions posed directly to a specific panelist. Somebody did bring up the point that the work from home and what positions lend themselves to that can also be looked at through a JEDI lens, through a justice, equity, diversity, and inclusion lens. So of course, being mindful of that. So if anybody has tips or thoughts, please share. And let's think a bit sort of empowering our leaders, managing up, advocating for change. What if any, pushback have you experienced around these policies? And how could leaders think about navigating challenges or barriers as they're proposing these things? And anyone can jump in.
Well, I think one of the things that we face is one of the things that actually Jeff spoke to, and I'm seeing a question in the chat about this as well, which is how does one create sort of equity, right? If working from home is viewed as a perk or an opportunity, and then people are in roles that really don't permit working from home, how do you create a sense of equity amongst employees? And how do you care for employees who do need to report on site and maybe experiencing some disconnect from their colleagues who don't, right? And I think also as we are experiencing students back on campus more fully, the students who left campus a couple of years ago are in some ways markedly different from the students that we are encountering now, with elevated levels of risk and struggle. And in some ways that can create more pressures for the staff who are reporting on site, who may more regularly interface with these students in person. And so then how do we also create an infrastructure to support the staff? How do we sort of adjust what we're doing to meet where students are and maintain being dynamic in the face of this sort of constant flux of things?
And to that, Jane, you mentioned that point, and I think it was in our questions as well, as how do you have the equity in that? And the phrase that I used quite a bit as we were developing some of these programs is that we certainly want to be equitable in how that takes place, but equitable does not always mean the same. And so in our sense of equity, it was really looking down to some objective lenses of what are the actual duties that need to be here, and working with managers and supervisors to get them to understand that being in for the sake of being in is different for someone that has actual duties that are required to be in. And so it's been a cultural, I think one of the things that we look at is a cultural lens on that. And so we really focus it on what are the actual necessary duties, and let's not create those just for the sake of creating those, but let's have it, on that. And then I think someone mentioned in the resiliency, because I think that's where it is how do we create the resiliency for those people that are not have the option for a work at home? How do we let them have the attention and the release that they need to find some of the what they need to get through these challenging times as well. But that's a phrase that I always use, is equitable doesn't mean the same for everybody. So.
I'd also just to sort of add to the conversation, thinking a little bit about when I have conversations with folks, they worry that people are going to abuse the privilege of working at home, right? And I have seen people do no work sitting in the office, right? So why are we so concerned that they're going to do, that people are suddenly, the great performers or even average performers are going to suddenly not work at home? So I think for me, and recognizing that I come from sort of the faculty perspective here, but it's about developing a culture of trust and really trusting that your employees are wanting to do their best work and wanting to perform for the organization. So really setting conditions that people are going to thrive in some way.
I think that's so smart. That idea of trust. An example: we just hired a curriculum developer, and on her interview, she was talking about doing homeschool. Some of the challenges that involved with that. And I had one of my leaders say, "Well, are we concerned about that?" And I said, "Well, let's look at what she does. It's curriculum development. What does it matter to us if she's doing the curriculum development at 8 a.m. or 5 p.m. or whenever is that flexibility around what schedule works for her, as opposed for it being because we have these office hours." And so I think it's that mindset of trust with some outcomes. And I think we've developed training and development for managers and supervisors to foster that sense of communication, that sense of trust. How do you manage remote employee? That's certainly different than someone in. But Margaret, you're right. Productivity, I think, has in some cases increased on this to a point where it's leading to more burnout. We're starting to think about scheduling meetings at 50 minutes so that you have some forced gaps. You used to have some of that commute and drive time to decompress a little bit between meetings. And in today's world with the Zoom, like this call, we can go back to back to back to back and all day and look down, and the whole day is gone in meetings, which causes a great deal of stress as well. So agree. Great comments.
Yeah, and for folks in the chat, we have our panelists and we thank them for their expertise. Certainly all of you at institutions may be aware of other innovations that are promising or that have been proven effective for your population. Lots of great questions around financial inequities. If somebody can work from home, then maybe they're not paying for parking on campus, whereas somebody who has to bring a car to campus is. So are there any kind of stipends or any ways that that's being acknowledged? Assumptions and presumptions around childcare, that if you're at home, maybe you're providing childcare to your children, but then of course that is a second job to your primary duties. So any kind of subsidies or any sort of innovative financial incentives that you guys are aware of?
All of the above for us. The finance, stipends of office equipment and looking at cybersecurity, all the things associated with work life are challenges. One thing on the childcare issue, I think that I noticed is really interesting is that we institutionally put a director of childcare in the HR office. And one of the things that I think looked at that is it used to be focused on childcare on campus, but now with remote work, a lot of that relationship is being built with our childcare providers in the community or support for people that are doing childcare at home for our faculty and staff as they go into this remote work. So it's a lot of more resource and relationship generation in the childcare as opposed to the physical on-site childcare on the college campus anymore. So that's been an interesting thing with us. Stipends, parking, for sure. Those were some of the big challenges as you go through. And I don't know that we've got a solution on that, but we have relative success with people looking at getting some productivity or some on-site bonus time, stipends for equipment, one time generally to get everyone set up in things. But those are the discussions that I think are the right questions to have on a campus as you work around those issues.
I'm wondering if I could just ask a question to the panelists and to our colleagues out there as we discuss all of this and we start to look at work differently and offering staff a hybrid work schedules and things like that. Are you finding that our students are wanting a face-to-face experience? And so are you finding any feedback from students that they want more face-to-face? And so an absence of your staff, access to your staff, is that coming up at all? Right? Like, so if your staff are out of the office, have your students been mentioning that? We've just been wondering if that's going to happen, like, you know.
We didn't see that, Nikki, to some extent. Like I said, we've got about 25% of our staff that are off-site any given day, but we set it through a policy-driven initiative that the first and foremost in the policy was that student experience, like you're mentioning. So that really is the driver, and then we gave a lot of empowerment into managers and supervisors to know their staff and to know those relationships and manage that. That was a big source of contention on our campus of not having it across the campus, but managers able to manage, and so some perhaps perceived inequities in that. But it was enough for us, we found on campus, to have 75% of people here, and specifically in those front-facing jobs with student access, that I think it gave the flexibility on the back end for some of the more administrative jobs, but still, where we found some lot of challenges in our residential campus. That's just become a big challenge for us in turnover and burnout with that, because the nature of that job changed so much from being part of the student life experience into more of the regulator of quarantines and vaccines and everything in that regard. And so that's become a particular challenge for us for the advising and the residential side of campus.
Yeah, residential staff are one of the areas hit pretty hard with the turnover. There was a question about clinical staff. So ACHA works closely with on-campus healthcare providers and counselors and health promotion professionals, as well as well-being personnel in a lot of different units on campus. Jane, do you have thoughts from the counseling center, how your clinical, how I understand that's different than a student health service, but just maybe some things that have come up to help clinical staff?
So something that we started doing during pandemic is for students who were in telehealth with us, we started asking them how much of a preference they had to remain in telehealth versus be in person. And what we found was that a large proportion of our students preferred to meet by telehealth. It's more convenient for our busier students, like grad and professional students. It's easier for them to just log in from home versus having to run into campus. And so we are primarily seeing non-urgent care by telehealth, and then we're doing urgent care on site. And we actually have not gotten a lot of pushback from students. As we keep moving forward, we're going to assess beginning to see students in non-urgent care on site as well. I'm sure that there will be excitement about that. I have noticed on our campus where there seems to be more push for in-person has to do with other wellness offices like recreation and wellness, right? So facilities, things where students are really getting together more for social activities. There has been much more of a press in those areas for an in-person experience.
Thank you. We have now officially transitioned into the audience engagement portion of the session, and we're getting lots of questions, not just in the chat, but also in the Q&A. So one question, did you receive any pushback from unions regarding some employees being allowed to work from home and others not?
Georgia is a right to work state, so I have nothing to say about this one.
Utah as well.
I could say from New York is not a right to work state, so a very active union presence here. I know that the unions negotiated here for folks to staff roles can work 2.5 days a week at home remotely, but we have several different unions on campus, and so there were certainly some conversations that happened around that, but it was certainly the unions that were pushing for it against what the university was asking for.
Thank you. And there was a question, actually, and these are two that are related, so I'm going to kind of blend one from the chat, one from the Q&A. The motivation for this session was that so many of the other webinars and offerings have been really focused on the individual and putting the burden on the individual to affect change through self-care and other opportunities. And so we wanted to look kind of systemically, thinking through a public health lens, what are some of the more institutional level things that could be suggested. And so one of the questions was to define burnout briefly. And so maybe we'll pitch that to Margaret, and then discuss what portion of burnout prevention is the responsibility of the employer and what portion is the responsibility of the employee. And the tie-in question was specifically from a faculty member saying, what can faculty members do for themselves? So really at that individual level when there's no support on campus, like some of the examples we've shared here.
So in terms of defining burnout, right, the exact definition is something along the lines of, which that doesn't help, right? Exact and something like is very much, it's a physical experience that folks are experiencing mentally, physically, having exhaustion, being unable to engage. It's kind of mirrors depression symptoms. Just really feeling like not able to go on in a way and to be productive and to find enthusiasm for what people have normally had enthusiasm for. And as per the question about how much is individual and how much is organizational, I would argue that at 90% of this is organizational, right? And that when I give talks and offer individual strategies, it's because organizations are failing people. And the organizations are creating these conditions that cause people to experience burnout. So while I can suggest, right, and I offered up to a faculty member in the chat, in the Q&A, right, you can set firm boundaries. For faculty who have agency to say no to things, you can set boundaries and not respond to email at night and not respond on the weekends. But that's the organization doing that to you, right? So you are forced to act back in these particular conditions. I would also add, there was a question earlier or a comment earlier in the chat about, we're trying to sponsor wellness activities and only 10 people are coming. People don't want wellness activities. People want more humane organizations. They want better compensation. They want to be able to work remotely. They want not to feel pressed upon. So I think it's a matter of rethinking everything that we do as an organization. So I go back to 90-10.
Thank you. There's picking up on compensation. There's a question about compensation. Financial insecurity is a huge source of burnout for so many people in my organization. This results in us being unable to attract and retain talent. Support for remote work and work-life balance is great, but that doesn't change the fact that the university staff wages are largely inadequate. So to my panelists and to the folks in the chat, any ideas around this?
Yeah, combine that with 7% inflation as well, and it's a real challenge. And I answered in the chat on that. We've worked with our business intelligence to try and get more data to our decision makers in the CFO's office and in the managers and supervisors, because I think up until this point, salary maybe didn't have a strategy to it, a retention strategy, a compensation recruitment strategy to it. And so that's what we focused on, is trying to get data to individuals of where the market data is, how fast it's moving, in what areas. Again, back to that equitable type of discussion, more objective, less subjective in how that is, and how you can adequately use that to develop a strategy on compensation for us. Our goal in this year, last 2 years actually, through this, using the data, was to get everybody in my unit up to 90% of market. Before we had people at 67% of market. And so just in the fact of, and then stating that strategy, communicating that strategy, so everyone knows what that is, I think is the people on the high end of that don't necessarily like that, but it's, again, it's trying to foster that trust and communication in setting that, and being as transparent as you can about why you're doing and what you're doing and where you're getting that information. So that's one of the things we've used here is really trying to get more data to the decision makers to make that feel more objective, less subjective.
Thank you. There's a question in the Q&A around, and this was actually one that we had thought of in advance. These aren't necessarily one size fits all policies, but when you write a policy, you're trying to have it help, the most people. So what is possible around mitigating some of the unequal application of, for instance, work from home? So you put it on the supervisors, but each supervisor is going to handle it differently. So as colleagues talk across units, it seems unfair what's happening.
I've had this conversation with a couple of deans, other administrators, and they complain that they want their people in the office and other units on campus do not. And so they're having internal turnover. And I said, well, that tells you to take a closer look, because they're similar jobs, same jobs, just different units. And it seems like another unit has figured out how to do that in a more flexible remote work way. And so we don't necessarily take the approach from a top-down administrator of saying they all have to be that way, but we found that voting with their feet and that move, I think they're pushing for us to put a level of everybody back in work, and my response to that generally has been that if we had that in place, then instead of just moving from unit to unit in campus, they'd be moving from the university to other businesses downtown that are providing that type of flexibility in their work. So it's a challenge for sure, but that's how we've handled it.
Has this come up for others? And another inequity that came up was the folks that are either required or opt, because they're more kind of social creatures, to be on site, feel like they're picking up slack from people that are remote. So any thoughts around how to work on that?
Something that comes up in our office, just our own, is we're a small unit. And so when one person is gone, it shifts, just coverage in general. And with us being sometimes in person, but still most of the time internal meetings are virtual. It's brought up the issues of just coverage of the office. Sometimes we're wellness coaching and things like that, working with our folks. But if we don't have somebody here at the front, we've been talking to ourselves about, I think we need to reschedule ourselves in different ways. And we're not the only ones that do this. Some of the academic units, they only have 2 support staff. And so if one's gone, the other one always has to be there. But what happens when that person's just sick or needs to go to the doctor? So all of these things keep coming up. And I like the conversation on the chat about, we just need to keep talking, because I don't think this is going to end, and we really need to be nimble with our folks, because it's just a different time. And I love the rethinking the way we work. I don't have all the answers, of course, but I'm enjoying the conversation and just the breath of fresh air, even though it's sometimes very difficult to have these conversations and folks are real frustrated, staff wise and things like that.
Yeah, so yeah, definitely let's keep the conversation going. That's one of the advantages of having 3 associations engaged at minimum. We know there are many of our colleagues that are doing this work as well, but let's keep the good ideas flowing. We are going to move to wrap up in just a couple of minutes, but I wanted to come back to a question around measuring effectiveness. So we're going to try a lot of things. And Nikki, your policy predates COVID, had been around for a decade or more. Any of the rest of you can speak to whether you've measured success of any of these policies, or what kind of metrics would you like to see to help you advocate for others to implement these?
That's always a challenge. We do a commitment survey, and I don't know that it'll pick that up, but we're getting set to go with the first one since the pandemic started. We really find the factors that lead to employee commitment. We measure 3 different types of commitment, but our pay, socialization, and training development. And of the 3, the socialization and training and development career opportunities always have the highest correlation with the type of commitment that we're looking for in our employees. So I will be interested to see what the socialization with what's taking place in that as we go through this now into employee engagement / commitment. The types of commitment we look at are affective, where they really connect, and that's what we look for. Want is that heart, mind, soul connected to the job. Normative is where they feel an obligation, and then the continuance, there's no better choices. So we look at all of those, and so it will be interesting for us as we look at that data post-pandemic, compare it to what we are seeing before. That'll be one way we're going to take a look at it. But I'm curious at anyone else that has that, because always trying to measure that is always a challenge.
So I don't work on the HR side, but I do know that employees do exit interviews. And, part of our strategy when we looked at things like compensation review really had to do with assessing who's leaving, right? Who's leaving and why, and what do we need to do in those particular areas. So for me, I think a huge marker is going to be being able to recruit and retain staff. And then, as Jeff is speaking to, really then assessing employee satisfaction with the workplace as well.
And Jane, I'll add on to that and just caution everybody. I think that pay is the easiest tool to go to, and I certainly think there's challenges with that, but don't discount that idea of culture in an office as well. And sometimes those don't get picked up quite as much in exit interviews. But it's a working hypothesis that I'm going on right now, is that that's the easy tool in the toolbox, but I'm not sure it's oftentimes the absolute most effective tool in the toolbox.
Yeah, I agree. And I think too, when we think about things like expressing appreciation, I think it has to be real and felt, right? And in that way, it's really managers knowing their employees and what makes their employees tick, right? So what are the things that are meaningful to the people that you supervise? And how can you demonstrate to your employees that you care about them?
And for my team, I would say it's flexibility is one of the ways in which we've been supportive.
Thank you. Well, I want to give each panelist maybe 2 minutes to summarize or think about what they want you each to walk away from this webinar with. So kind of a 2-minute little encapsulation. I will highlight some resources on screen. We will send information, including a recording and the slides, out to everyone who is registered for this event. So look for that in the next few days. And then the recording will also be posted at the very least through the ACHA website and probably through the other sponsoring units as well. So who wants to go first with their 2-minute things to walk away with?
I can go if you'd like. I was just going to say that it's my hope that our institutions have a lot of what I would call well-being policies, or just things that we're doing across the institution that support our colleagues, and that maybe as a director, fill yourself with information so you can share that with your team and with colleagues, just in case, right? But I think at the end of the day, give one another grace, and that to me means myself sometimes too. So not only I want to give it to my colleagues and to my staff, but also to myself, right? Because we're just really in a interesting time of transition. And so anyway, I just wish you all so well, but thanks.
I'll go. And as you can see, there's so many resources that are out there on the CUPA-HR website. This has been a topic of conversation for our HR leaders across the country, and not only taking care of the people in their universities, but taking and looking at self-care for the profession and for the leaders themselves. And I think a lot of that goes to the mindfulness, the ability to center. That becomes the key so much in the resiliency of that, and finding ways to take time to recharge those batteries. So much of us in HR, I view myself as a caregiver to the employees, and I think a lot of our meetings have been about acknowledging the stress that is placed on all of us as well. And sometimes that acknowledgement and that ability to say that I am having a tough day is cathartic in and of itself. So I would say take time for yourselves, look at the policies that you can. Some of this is done through the policies, but so much of it, I think, is the ability to maintain those connections. We had someone speak to us as CUPA-HR leaders last week to talk about, find those people that give you meaning in life, those 3 to 5 individuals in your life, and make sure that you maintain those connections, because that's some of the work that does to recharge and bring back the meaning that all of us are feeling exhausted and from. So that'd be mine. Take time for yourselves as well, as much as you can, and stay connected.
As managers, now is a time where creativity is key, unlike any other time, right? And I think that now more than any other time, it's really important to listen to your employees and the things that they're saying to you about what they need. There's policies, and then there's the structures that are in place to support those policies. And I think as much as we can, creating a structure that supports the policies that are in place that support staff well-being are really important. And if you can't do that, I think it's really important to be transparent about why, so that your employees aren't left wondering. I also really appreciate these points around taking care of yourselves. I'm realizing more and more, no one's ever going to give me permission to take care of myself, right? No one's ever going to make that time for me. It's time I have to claim for myself. And I think that up to COVID, we were in a culture where it was go, 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 go. And to some degree, well, to many degrees, it's still like that, right? But I'm finding more and more that I have got to claim that time in order to keep going. And so I really want to encourage all of you to do that as well.
Sort of building off Jane's point, and this isn't exactly what I was going to talk about, but I gave a talk a couple of weeks ago talking about distinguishing between the urgent and the important, right? And the important are things really that feed our own souls and work to our own goals. And maybe that's making time for yourself in ways that are not valued, or working on projects that are important to you. So I would encourage all of us to be sure that we're prioritizing what feeds us. But I also want to circle back and just remind us that we can't keep going and doing what we've been doing for the last 10, 20 years. I mean, if nothing else, if the argument that like burnout isn't enough, which since you're all here, I think that you can get on board with that, keep in mind that folks who are entering the workforce now are very vocal about what they value. They're very vocal about many things, as I have them in class now, but they're very vocal about choosing jobs that really allow them to have this distinct separation from work and life. And on top of that, right, they're a smaller cohort. So we're going to have labor shortages. We're already seeing that now as we're struggling to fill positions. So if nothing else, from a sort of a business case, we could make the argument that we need to shift our practices simply to keep our universities going. From an ethical perspective, of course, we need to shift our practices so that we can reduce burnout and help employees craft this life that allows us to thrive and not have burnout and be engaged and be happy both on campus and off.
Well, thank you, everyone. And I want to thank CUPA-HR and ACE for collaborating with us, and a special thanks to all of our panelists and to all of you who carved out time, again, between the urgent and the important, and you made this important enough to come today. And so we'll share out the information and the recording. Feel free to share with other colleagues who couldn't join today. And thank you so much for being here. Thanks, everyone.